All right. So this evening we want to discuss general mental health, what mental health is, and what mental illness is. So basically, that is what we want to look at this evening. And before we talk about mental health, let's look at what health is in general. When we talk about health, what are the components of health? Should health just mean that I'm fine? If somebody says I'm fine, what does it mean to say that I'm fine? So, but I hope I can be heard audibly, right?
Yes, please, we can hear you.
All right, good. So we want to talk what is a component? What constitutes health? If we talk of health, if somebody says I'm fine, what does it mean to say I'm fine? Generally, four researchers have identified four areas that make up what we call well-being or health. Our physical well-being, our mental well-being, our social well-being, our spiritual well-being. All these four coming together makes an individual healthy or a balance in these four major components. We can say the person is healthy. So talking about the physical, that is our body, our stature, structure, everything that makes us. So where you are not having any headaches, no stomach pain, no deformities. Even if there are deformities, it doesn't make you disabled. All this, uh, talking about physical health, that is absence of illness. We can say this person is physically wealthy or healthy. But being physically healthy alone, is it enough to say that I am fine? We say that alone is not complete. So the mental wellness of the individual is equally very important. How is your mental processing like? Your ability to think. How is your perception of things and self-like? How are you feeling emotionally? Your behavior towards self and others, towards work, towards uh, every situation. How is it like? Is it balanced? How are you able to relate? Are you feeling depressed? Are you feeling anxious? So, talking about health, your mental wellness is also important in addition to your physical health. However, that alone is not enough. Talking about the social, how are you able to relate with families and friends? Your social connections, how are they? Your cycles, how are you able to interact with people around you? Are you able to go to work and be able to coexist with workers or your colleague workers, your subordinates, your bosses? How are you able to relate with them? In your community, how are you able to cope in your community? This is equally important. And talking about your culture, how are you able to meet up the social and cultural demands? What are people saying about you? Is everybody seeing you as out of what we call the normal per our cultural standards? Then, so far we've identified three components of well-being: physical, mental, social, and then we have what we call the spiritual. Your spiritual well-being, how is it? Sorry, your belief systems. your purpose in life. What is the purpose? Do you feel that like you have a purpose living? Your interconnectedness with your supreme power. How is it like? How do you feel? Do you feel your God is with you? Or you feel your God is so far away from you? How do you feel? All this is necessary for you to say that you are fine. That divine power, your religious organizations, how are you able to cope in there? So for someone to say that he or she is fine, there should be a balance between or among these components, your physical, your mental, social, and spiritual well-being. There should be a balance in here for us to say that you are fine. Now let's move on. So talking about this, our interest this evening is about the mental health component of health. Yes, we appreciate that these four components, physical, mental, social, and spiritual, comes together to make someone well. And that is what well-being stands for. But our focus this evening is on mental health. And what is the focus we are looking at? How the person is able to think, feel, and behave. The person being able to manage his or her stresses, their daily stresses, being able to function properly. Is a person deviating from the normal? Is a person feeling worthless among people? What is he or she feeling? What is he thinking about himself, him or herself, and others? The behavior, how is it like? Are they dysfunctional? Are there some damages that is coming into the person? This is the mental health component you're looking at. If you want to align this biblically, Luke chapter 2, verse 52, it says that Jesus grew in wisdom, and wisdom here, we are talking about the balance, well-being. Jesus grew in wisdom, and that is mental, and in stature, physical, and in favor with God, his spiritual well-being. And then all people, that's social. So the scripture is giving us a sample of how wellness or well-being looks like. So we draw inspiration from Luke chapter 2, verse 52, which says that Jesus grew in wisdom, in stature, and in favor with God and all the people around. First Samuel chapter 2, verse 26 also shares the same idea. It said, and the boy Samuel continued to grow in stature, physical, and in favor with the Lord and with men. Hallelujah. Amen. We're going to talk about mental health issues. Usually we end up seeing, we actually align mental health with mental illness. So we should know that mental health is where the person is in the right frame of reference and able to function in his or her daily life, be productive, and be meaningful to their society. Their relationship with others are balanced. Here we can talk about mental health. When it comes to mental illness, usually somebody who they'll quickly picture someone who is on the streets, who is in tattered clothes, and say that is, we talk about mental illness, that is where it ends. No. So we are saying that mental issues beyond what we call in quotes madness. Let us look at some, and this list is not exhaustive. There are more and more and more. And then some of these are also in, like, it's in clusters. So for example, talking about anxiety disorders, we have different disorders that are within anxiety disorders. The panic, the panic attacks or panic disorders are part of anxiety disorders. Talking about the social phobias, all the phobias, they're under the anxiety disorders. So talking about anxiety, that is where an individual have this sense of fear, like something's about happening to him or her. But what happens here is that there's no basic evidence to what the person is scared of. And it can be related to a particular situation, event, or general. It can be just something general that a person has this fear or stress towards. They have mood disorders, which a typical example is depression. Bipolar is equally a mood disorder. And as I mentioned, but this 14 list over here is not exhaustive, but when you take one each of them, it has a lot of other components in it. So over the period, as we are going, we'll be picking them one after the other and break them down into details to see what entails each of these disorders. So you have the psychotic disorders as well, where a typical example is the schizophrenia. So usually when you talk about psychotic disorders, which means that this is the situation where the person might be hallucinating, deluded, and their perceptions are distorted, how they perceive things, how they think, how they feel. There is some kind of default over there. So the person is not able to think or they are not able to perceive normally. And usually when those ones happen, that's what most people consider to be mental illness, but it goes beyond that. Somebody can be very okay and have an acute or a brief psychotic episode where their behaviors will go a bit off, but quickly, with little support, they're able to bounce back. We have stress-related disorders, which example is post-traumatic stress disorder, which happens if someone is exposed to trauma for some years ago or some period back, and those things, memories of those things, interfere with their current daily activities. We can be talking about stress disorders. Stress comes in a lot of packages. So as we mentioned, these are just uh, highlights we are looking at. We also have the neurodevelopmental disorders, which dementia is part or is one of the neurodevelopmental disorders that we can be talking about. We have personality disorders, which is we have about 10 based on we have 3 clusters and 10 individual personality disorders according to the DSM-5. Sexual dysfunctions and disorders are also there. Substance use disorders, that is drug addiction, sleep disorders, eating disorders, impulse control disorders. All these, we'll be discussing them into details. Then disorders due to medical illness, like HIV and the rest. Psychosocial issues, abuse, marital and family conflict, pregnancy-related issues, work-related issues, career issues, financial issues, all these things borders mental health. All these things borders mental health. So with time, we'll take them one after the other and expand or elaborate on them properly. So if you look at the statistics, all these conditions affect both men and women. Some are more than others. So this is just briefly some statistics. When you take depression, for instance, you realize that the number of people living, this is a 2017 data, number of people living with depression as of 2017 is 264 million. And out of that, we have the male to female ratio, where we are saying that 2.8% of this are, sorry, 2.7, yeah, 2.7 of this ratio is made up of males, and 4.1, which is almost times 2 of the males is the female. So meaning more females report depression compared to men. But these statistics usually rise that one thing is most men do not report. So we can say they might be under reporting of figures. However, per what we have indicates that we have more females experiencing depression compared to males. The anxiety disorders is almost the same, where females are rating high. Bipolar is almost even though with females slightly high. I think eating disorders, same thing. Like they all follow the same pattern. However, this doesn't mean the men are equally not abusing or experiencing some of these things. It just shows that it's about men, that character of men not reporting their illness can be accounted to for some of these things or these statistics that we are seeing. So what is mental health? Now we want to come down and find what is mental health. But before talking about what is mental health, what is health, and which we've already said. So according to WHO, health is a state of complete physical, mental, social, and spiritual well-being, and not merely the absence of disease and infirmity. And I think you've explained this thing earlier. And then mental health also encompasses our emotional, psychological, and social well-being. It influences our recognition, perception, and behavior. So there are good mental health and poor mental health, as we mentioned earlier. And when we talk about good mental health, so this is a situation whereby a person is able, a person knows his abilities, knows what they are supposed to do at a particular time, can cope with their normal daily stresses, they're able to work productively and contribute to their community effectively. So if someone who is having good mental health, we see the person being balanced. Then what of poor mental health? So we've seen good mental health. Then what about poor mental health? So it's just the direct opposite of what a good mental health is. So this is why the person finds it difficult to manage his or her daily activities. Their thinking abilities are a bit dysfunctional. The way they feel, act, and cope with daily stresses are not as expected, and there may be some maladaptive behaviors that they may be putting up. So poor mental health does not actually mean one has mental disorder. We should understand this. Poor mental health does not mean one has a mental disorder. It only ascertain when one goes through a formal assessment. So as we are progressing through this presentation, maybe someone may see some one or two symptoms, and then quickly they may want to jump into conclusion that I have this condition. No, you should subject yourself to assessment before we can draw a conclusion like that. So we didn't want anybody to panic. Maybe after talking about some symptoms, panic and feel you are having any particular mental disorder. But this awareness is to make us see what is there, and possibly if we see any of ourselves, if we see ourselves in any of these symptoms, we will take action as early as possible. So just as expanding on the definition of mental health, we say that a state of well-being in which every individual realizes their own potentials, they're able to cope with their normal stress of life, can work productively and fruitfully, and he or she is able to make a contribution to his or her community. And it is such a way that like it's on a spectrum where at a point an individual may find him or herself in a good mental health, and another time will find him or herself in a bad state. So everyone moves up and down the continuum of varying degrees. So we all have mental health. Some of us have mental health problems. So that is how it is at a point. But so what we said is that having a poor mental health doesn't mean you have mental health disorder. if at the time you are so stressed out, then you tend to be forgetting things. At that moment, there's poor mental health, right? But we can't say that you have a mental health disorder. So as we said, it's on the continuum. So if you see the ranging or looking at the bars, so let me start with the extreme right. When someone is in excellent, without a full but excellent uh, mental health, the person is so cheerful, joyful. There's that energy to do whatever they want to do. They are performing at their optimal level. They're able to flow with society very well. They're able to realize their potentials. So that's when the person is in optimal mental health. When like it is dwindling, when it's getting down a bit, still the person remains positive, calm, performing well. They sleep well, they eat normally, normal social activities and the rest. Now, when the problems start coming, when the person is not managing their stresses well and issues start popping up, realize that when there is told with a little thing, a person is being worried. So worry, nervousness, irritability, sadness, trouble sleeping, getting distracted easily, withdrawn from society, all this. When these symptoms start, it should be alerting you that no, at this point, your mental health is being compromised. So as early as possible, seeking help is vital. But if you don't seek help at this side, all those things that you are feeling will increase. The symptoms that you are feeling will double up. So this time around, you start struggling. And in the struggling stage, you become so anxious. You may become depressed. You feel so tired. And poor performance, poor sleep, poor appetite. And even at the struggling stage, if you do not still take any step to address your challenges, you move into the crisis state where everything becomes profound, very anxious, very low mood, absenteeism, exhausted, very poor sleep, and weight dysregulations. All these things to tell you that. So we are supposed to always watch ourselves and find where we are on the continuum. I want to find out if you are following. If any response can come for me to know you are following my the presentation. Hello, is anyone
Yeah,
there?
following.
All right. Mr. Hassan, are you there, please? All right, so we are talking about what is the impact of mental health. What is the impact of mental health on our lives? So mental health impacts our well-being in numerous ways. So if you are not taking care of yourself and get to that crisis state, your physical health can be compromised, where mental health can be linked to chronic diseases because you are not taking care of yourself. The stresses are on the increase. You are becoming anxious by day. You are feeling so down, depressed. All these things can have an effect on your physical health. Heart diseases, maybe where your BPs will start to be having issues, respiratory problems, digestive problems. All these things will start coming. Even your immune system performance decreases. So you start falling sick with a little issues that we may pop up. So your physical health is compromised when your mental health is at stake. There's poor productivity. So mental health affects our work performance, absenteeism, and job satisfaction. So if your mental health start dwindling, you realize that your performance at work will also start suffering. Even your relationship with people. So you're saying that mental health influences personal relationships, social connections, and family dynamics. Your daily functioning will also be affected. So such as your sleep, your eating. Sometimes you just even forget about yourself and you're not able to care for yourself any longer. So generally, your overall quality of life will be undermined, where that sense of fulfillment will start going away. That's why somebody will say that for me, I feel worthless. They feel becoming feeling less of yourself, where you think life is no longer worth living. And then suicidal tendencies to start coming in and all those stuff. And simply because you are not taking care of your mental wellness. So what are the factors that affect mental health generally? Factors that affect mental health in Ghana. So we're talking about childhood trauma and abuse. This concept is something that is very serious. Childhood trauma. So there are a lot of us that have some perceptions now in adult age, that some of these perceptions or our way of thinking stems right from the kind of exposure we had during growing up, the kind of upbringing we received, the environment in which we grew, the trauma that we went through whilst we were kids. So right from childhood, we have formed a particular perception about ourselves and make it look like this is how the world must be, this is how the world is. So a child who is always being beaten feels that the world is unjust. They are not nice people. So they grow up and they become either tough and will become social deviants because they feel that is how people in this world don't like me. So either they withdraw from people, they have that uh, low self-esteem or low self-concept, poor concept may be happening, or they've gone through some abuses. Because of that abuse, they become uh, fearful. Sometimes there's that anxiety in them thinking what happened to them when they were growing up will happen again. And at times, severe or long-term stress, which can lead into burnout, also impact on our mental health. Drug and alcohol use or alcohol abuse. Bereavement, loss of a loved one can also can cause someone to go into mental health struggles or crisis. Then childbirth. Issues of childbirth also have some relation to because when there's pregnancy or even before pregnancy, we have these hormones that will change to allow the system to accommodate the pregnancy during the pregnancy and then after delivery. So sometimes these hormonal imbalances, if the hormones don't balance properly, can bring about mental health challenges. Physical causes can be head injury and other illnesses, long-term health conditions, marital or relationship challenges. It's also one of the things that is affecting a lot of people. Maybe birth defect, unresolved childhood and mental health disorders, domestic violence, someone who is exposed to domestic violence. And mostly we say most of the mental health issues run through some families. So it can equally be as a result of genetic predisposition. What are some signs and symptoms of mental health challenges? So at times can be feeling sad, down or empty for more than 2 weeks, feeling anxious, worried, or on the edge all the time, changes in appetite, suicidal thoughts or behaviors, self-injury, feeling like you want to sleep without even waking up. That is when someone is having these suicidal thoughts. They feel like I just want to sleep. And that is they don't even want to wake up again. They want God to just come and take them away. Excessive anger or irritability can also be coming. Forgetfulness. The little, like you can be holding even your own phone and be looking for the phone. You are holding your own key and looking for the key. These things happen, but some can be severe. Those ones can be as a result of stress, but it can get severe where the person will have chronic forgetfulness. Hallucinations may be happening. Hallucination comes in different forms. So you have the auditory, visual, tactile, olfactory, among the rest. So hallucinations are false perceptions or false sensory perceptions. So sensory perception means talking about our senses, where the person is actually perceiving a particular thing, but in reality, there's no evidence of that thing existing. So talking about like the visual hallucination, for instance, the person will be seeing some things that he or she is the only one seeing that. Other people around them cannot see, but they can tell that I'm seeing this, I'm seeing a ghost, I'm seeing sometimes the thing looks so clear that they can tell you. Sometimes it's just a shadow-like structure they are seeing. Either the thing is threatening them or whatsoever. So they are seeing something. It's told that they are seeing angels and spirits and all that. That's the visual. Also, the auditory is where they hear voices. So they are actually hearing voices talking to them, telling them things. Sometimes the voices are so clear, some too they are not clear, but they can hear sounds of people speaking, but sometimes they are not able to identify what particular sound it is. Disorganized, severe mood swings, disorganized thinking, extreme anxiety, social withdrawal, suicide thought. I've mentioned that. Paranoia, where somebody is always suspecting someone, always suspecting people. They feel that people are doing things behind you. Secret, especially in relationships, this person is always suspecting their partner. Paranoia tendencies without any evidence. Inability to cope with daily activities, impaired cognitive functions, sleep disturbances, loss of interest in activities, change in appetite, burnout. I mentioned that. Easily irritated, concentration difficulties, and suicide tendencies. One good thing about mental health issues is that to a large extent, they can be treated. Some can be treated and need to go forever. Some to have to be managed. So we have those that you need the medicines for are there. The medical treatments are there. We also have the psychotherapy that you can provide to the individual. So talking about medication, you have the antidepressants, the anti-anxiety medication, the mood stabilizers. So depending on the symptoms you are presenting, if what is necessary is if there is the need for. So if you see the slide here, realize that it's in kind of steps. Usually medication is just one part of the whole treatment. And do you have other alternative ways of managing mental health issues? So psychotherapy, where we use the psychological therapies to help an individual, cognitive behavior therapy, the psychodynamics therapy. These ones, maybe if you want to go into more of uh, how to handle the person professionally, we can go into the details of that. Lifestyle changes can equally help in the management of mental health issues. Regular exercise, healthy eating, sleep hygiene, stress management techniques, social support and connections, mindfulness-based interventions, music and art therapies, and journaling, among others, are all management options that can be explored to manage mental health issues. How then do we prevent? Prevention. So we are saying that we should foster a community of, uh, we should foster a supportive community where we encourage collaboration and teamwork, promote empathy and understanding each other. There's people who never celebrate successes for themselves. They never celebrate successes for themselves. So you are saying that celebrate success and support through challenges. Seminary training, like some of these programs we are doing, we do workshops and we learn about ourselves. And also we create healthy boundaries and self-care to encourage work-life balance. Model healthy habits like exercise, healthy eating, among others. Then we also prioritize relaxation and stress reduction techniques. Regular check-in and assessments, annual mental health evaluations, they are all possible ways we can use to help ourselves to prevent some of these things coming back from us. They are saying that let us reduce stress and promote openness, normalize mental health discussion, share personal struggles and successes, encourage vulnerability uh, among others. So these are just some healthy tips for us to bring the discussion to an end. It's already 10. So we say practice mindfulness. But I think I will pause here, and I don't know if there are any questions. We take it before we conclude. So the healthy tips, practice mindfulness and stress management, meditate or breathe uh, deeply. All these are exercises with time. We'll take them after the other. Limit alcohol and drug use, set boundaries, manage work-life balance, learn how to say no when needed. And then we should also learn how to disconnect from the screen. Always our faces are in our phones, our laptops. We should also learn how to manage those ones. And let's make time to refresh ourselves. Engage in meaningful activities, hobbies, spend time in nature. And sometimes you can volunteer to do things that makes you happy. Most importantly, seek professional help when needed. The therapy is proactive, not reactive. So the therapists provide tools to navigate their challenges. Consider medications if recommended. And reflect on purpose and values. Set goals, small achievable objectives. Practice gratitude. People don't know how to thank themselves upon the hard work they do, or don't appreciate people when they help them. Let us practice gratitude. So daily reflection on what you are thankful for can shift your mindset. Then spiritual practices, prayer, meditation, reading of your Bible, all this can help you stay in check. So thank you very much for your attention. Madam Boachi and Mr. Hassan, I don't know if you have any questions.
Yeah, we are still here.
Any questions so far?
The presentation was good. For now, there's no question from my side.
Okay.
Mm. But I hope you'll be sending the PDF, the file in the PDF in the group. Or
Yes, I will.
okay, so that we can learn through that. Maybe if you want to reflect back.
Okay. And then I also share the recordings as well.
Yo, thank you.
Madam Boachi, please, do you have any question or concern? Okay. So we'll bring uh, our presentation for today to an end over here. Uh, we'll meet another time. thank you for your time and good night from me.